of discussion is rebreathing. Rebreathing is an occurrence whereby the patient inhales gas that was expired, and that gas does not have any additional fresh gas flow or oxygen and is enriched with carbon dioxide. And because of that, there is washout of oxygen from the lungs. And when that occurs, the levels of oxygen in the lungs decrease dramatically. As you can see in the graph, where you can see it takes 5 to 10 seconds for levels to drop, and the alveolar oxygen content drops and the arterial oxygen drops as well. So the thing is, it's a very, very serious condition, and one should try and avoid that occurring. It's even worse than acute obstruction that occurs with kinked endotracheal tube, because with the kinked endotracheal tube with acute obstruction, there's some reserve in the lungs in the form of FRC, or functional residual capacity, where oxygen is still available to maintain oxygenation until that obstruction is relieved within that short period of time. So the thing is, with the rebreathing, we should do as much as possible to avoid it from happening. And I find that, when you're doing a general anesthetic, just holding the reservoir bag and looking at it actually avoids having the patient to rebreathe, because it will tell you a lot of things. It will tell you whether the oxygen has been turned on, whether the right circuit was selected, because maybe the circuit wasn't changed from the auxiliary common gas outlet to the circle system, because maybe the previous patient had a spinal or regional anesthetic and needed 40% oxygen, and the ACGO outlet was used, but then it wasn't switched back to circle, and because of that, no fresh gas flow would go to circle and the patient would get hypoxic. The other thing is, the circle system itself can have detachments, and when that occurs, fresh gas flow won't go in and the patient will rebreathe and get hypoxic. And last but not the least, the reservoir bag will also tell you if the patient has become apneic because of administration of opiates. So the reservoir bag is very important. It tells you a lot of things. And when it's inflated or about to burst, it can tell you that the APL valve is closed, and that can make it very, very difficult for the patient to breathe. So always, keep your reservoir bag and look at it, because it's your friend. It will help you and it will prevent you from any mishaps.